Hello guys, good afternoon. This is Professor Henderson, and today I'm coming to you with another simple video on Foley catheter insertion, removal, and maintenance using role playing and gaming. If you like these types of videos, I would strongly suggest that you consider subscribing to my YouTube channel, like and share, and turn on your bell notification. Thank you so much for those who have been subscribing to my YouTube channel. I greatly appreciate that, and continue to watch these educational videos to provide you with some educational knowledge. So this poster that I created here, actually I did it for my graduate program at Stony Brook University, and I wanted to share this poster with you to provide you some understanding in how to go about creating a simple poster for a project. So the purpose of this poster was to educate undergraduate nursing students on Foley catheter insertion, removal, and maintenance using active teaching strategies of role-playing, gaming, and demonstration to reduce the incidence of CAUTI, catheter-associated urinary tract infection. As we know that in education, nurse educators, we are trying to use the most active teaching strategies. Back in the old days, we were using passive teaching, and it's not an effective way to educate students. So we're trying to get away from that and use an active teaching strategies. So let's talk about the population that was used in this project. So the population, nursing students age ranging from 20 to 35 enrolled in a CUNY BSN nursing program. These students were third-year baccalaureate nursing students. N stands for the population, 30 students were used. 80% of these students were female and 20% were male. So let's talk, since we have talked about the purpose and the population, let's talk a little bit about the background and significance. So a little background about this project is to provide nursing students the opportunity to gain hands-on exposure to clinical skills by integrating an active teaching strategies of role playing and gaming to teach catheter insertion and care to enhance student clinical competency. As we know, there is a significant need for educators to integrate an active learning process into the clinical settings to educate undergraduate nursing students on catheter insertion, removal, and maintenance. So CAUTI, catheter-associated urinary tract infection, is the most common type of healthcare infection that occurs in a hospital or a long-term care facilities. Now, according to the CDC, about 15 to 25% of hospitalized patients receive a Foley catheter upon admission will acquire catheter-associated urinary tract infection. So as nurses, we have to really screen patients carefully for the indications of a Foley catheter, not because a patient coming into the clinical setting, they're a candidate for a Foley catheter insertions. And we know there are several criteria for indications according to the Center of Disease Control and Prevention for a Foley catheter, such as neurogenic bladder, such as urinary retention, such as spinal cord injuries, such as patients that have benign prostatic hyperplasia, patients that maybe have stage 3 or 4 pressure injuries. That way you can keep that pressure ulcer clean and dry and preventing seepage of any type of urine or feces into the pressure injury site, therefore preventing any type of infection to the pressure ulcer. So as nurses, we must screen patients for the appropriate indications. So learning theory, as we know, there are several learning theories out there that can be utilized for teaching or educational purposes. But for this project, the learning theory that was utilized was constructivism. So according to constructivism theory, knowledge is constructed by one's experience, and student-centered learning is the foci. Learners are actively engaged in the learning process to gain deeper understanding of course contents. Students engaging in meaningful activity to gain skills through collaboration. Learner constructs knowledge through process of active inquiry and exploration. So that was the theory that was used in this project. Students are constantly, through experience and through exposure, they're learning how to collaborate with other students, and they reflect back on their past experiences, and they merge these knowledges to construct new knowledge. So now I want to talk to you a little bit about let's talk about the teaching methods and interventions. So we know there are different teaching methods and interventions that can use in education. So the teaching method that was used during this project, I administered gaming questions that were administered to the undergraduate nursing student to test their didactic knowledge of catheter, insertion, and care. Also, I used demonstration in the clinical lab, and the student returned demonstration using hands-on, and in the lab is an integral aspect of gaining psychomotor skills. So role-playing activities within a small group also was utilized to gain skills. PowerPoint presentation, also using a video to connect with visual learners, were also utilized in this project to gain a better insight. So let's talk a little bit about the discussion of this project. So student learning outcomes, the SLOs, which is provide students with a framework on the lesson plan, was achieved. Evidence in the student's ability to return demonstration of a Foley catheter, insertion, removal, and care in the clinical skill lab. Also using the gaming and role-playing was proven an effective teaching strategy in the classroom. Students were able to pass their clinical skills of catheter insertion and removal by greater than 95%. Literature review supports the teaching strategies and proven using games, role-playing, and demonstration in the classroom are all effective teaching methods for gaining competence. So that's on discussion. So let's talk a little bit about the let's talk a little bit about the let's talk a little bit about the evaluation results. So the way this project was evaluated used a Likert scale was used to evaluate the teaching activity, and 90% of the students strongly agree with the active teaching strategies. Post-quiz gaming questions, students score greater than 90%, significantly higher when compared to the pre-test score of less than 60%. Ongoing verbal formative feedback during group work was also provided to students to promote learning. 95% of the students reported the teaching strategies were highly effective and engaging. So, conclusion of this project, students express positivism, working within small group using role playing and gaming to gain skills and knowledge. Gaming and role playing are active teaching strategies to gain competence in catheter insertion and removal. Professional expectations were met, evidenced by students' ability to pass their clinical skills on Foley catheter insertion and removal greater than 90%. So I also have a little chart here on the population that was used, 80% female, 20% male, and the pre and post test results here, and a little chart on catheter associated urinary tract infections. So I hope you like this poster. I hope you find this poster engaging and informative. If you do, please consider subscribing to my YouTube channel, like and share, and leave your comments below in what type of educational videos you would like me to provide you to gain a greater insight. Thank you for watching. Bye.